Hepatitis B virus, or HBV, is a partially double-stranded DNA virus. It is circular, it has an icosahedral capsid, and it has an envelope. Right, so in this video, we are going to talk about how is the HBV transmitted, high-risk groups, pathophysiology, clinical features, diagnostics, and here we're going to spend a decent amount of time talking about the HBV serology. And we'll conclude by talking about one complication, which is actually hepatitis D virus infection. So let's get into it. Hepatitis B is transmitted, number one, through sexual intercourse. Number two, through parenteral route. So here we are talking about needle stick injury or contaminated instruments and shared needles. The other way is through perinatal, right? So let's talk about the high risk group, right? So in the first group, we have IV drug users, long-time IV drug users, infants of HBV positive mothers, professions with exposure to human blood and or seminal fluids, and also individuals with multiple sex partners are at risk of getting the HBV. Not forgetting hepatitis C virus or HCV or HIV positive individuals. All right, so what happens is, in hepatitis, we have acute infection and chronic infection. Acute infection is when the infection resolves within 6 months, and chronic is when it persists for more than 6 months, right? So, this is the pathophysiology, right? And let's begin with acute infection. So in this case, there will be hepatic inflammation with destruction of hepatocytes, right? Okay, so here I'm going to go through the replication cycle, how this HBV cause hepatic inflammation and destruction of the hepatocytes. So after entering the host cell's nucleus, the viral polymerase completes the positive strand of the virus partially double-stranded DNA, right? So this one is a relaxed, so it's called a what? A relaxed secular DNA, right? So what will happen to this relaxed secular DNA is that it will be converted to covalently closed secular DNA or cccDNA, right? So this cccDNA or covalently closed secular DNA is then transcribed into viral mRNA by host RNA polymerase. From there, the viral mRNA will leave the nucleus and then translated into HBV core proteins and reverse transcriptase in the cytoplasm. This viral mRNA and reverse transcriptase are packaged into the capsid, where the viral mRNA is then reverse transcribed into relaxed secular DNA, right? So from there, the new viral DNA genomes are enveloped, and then they will leave the what? The cell as the progeny virion, right? So on the process of leaving these cells, these hepatocytes will be destroyed. So here is an image showing the viral replication, right? From here, we have our what? The HBV virion, right? So this is entry and penetration, uncoating, right? So here is the relaxed secular DNA, right? And as you can see here, is complete, right? And then it's converted to covalently closed secular DNA, right? And from there will be transcription, that's from DNA to RNA, where we have a lot of what these mRNAs, right? And translation into what virion proteins, right? So here, as you can see here in the center, you still have what like this particle is still RNA, and is going to be converted into DNA by what? By reverse transcription, right? So here, but this result will be a negative strand, right? So this negative strand will be converted to what? To positive strand, and then there will be packaging and then a release or viral secretion, right? Okay, let's move on. Now let's talk about the chronic infection. So what happens is like this chronic infection results if our immune system is unable to clear the virus, right? So here we have two main ways. Persistent hepatic inflammation with necrosis, mitosis, and regeneration process will lead to cirrhosis, cellular dysplasia, and hepatocellular carcinoma, right? Another way is through integration of the hepatitis B virus DNA into the host's genome. This will lead to altered gene expression of endogenous genes, chromosomal instability, and hepatocellular carcinoma. Now let's talk about the clinical features. As I said before, we have acute infection and chronic infection. Right, so starting with acute infection, serum sickness-like syndrome can develop during the prodromal or pre-icteric period. And also there will be rash, polyarthritis, and fever. About 70% of the cases are subclinical, right? So it's subclinical hepatitis. And in about 30% of the cases, patients present with symptoms, right? So this symptomatic hepatitis, the symptoms include fever, skin rash, arthralgia, myalgia, fatigue, and also other symptoms include nausea, jaundice, and right upper quadrant pain. So these symptoms can be also found in other viral hepatitis infections, right? So they are non-specific, right? So let's move on to a chronic infection. Chronic HBV infections are defined as infections persisting for more than 6 months with detection of hepatitis B surface antigen. Just a moment, I will talk about this. And possibly symptoms of liver damage. This will actually imitate the acute hepatitis and result in hepatic failure. Extrahepatic manifestations occur in about 10 to 20% of the cases, and they include polyarteritis nodosa and membranous glomerulonephritis. Right. So now, before talking about serology of HBV, I just want to show you the structure of this virus, because in the last slide we saw the HBV surface antigen, right? Okay, so the structure, the basic structure looks like this. Okay, from outside, what you are seeing here outside the outermost layer here, you find the hepatitis B surface antigen, right? So this is the hepatitis B surface antigen outermost, right? Then inside here you can see this red layer, right? So this one is hepatitis B core antigen, right? Labeled here. And between the hepatitis B surface antigen and hepatitis B core antigen, in between, you will find the hepatitis B envelope antigen, right? Labeled here, right? And inside here, of course, you will see the partially double-stranded DNA. Here you have your DNA polymerase, right? So we are going to see more of these in our next slide, where we talk about what the diagnostically important antigens and antibodies of HBV, right? So the first one, as I said, here we have the hepatitis B surface antigen. This is actually protein on the surface of HBV, and it marks like the first evidence of infection. Our bodies are able to produce anti-HBV surface antigen, right? And these antibodies will actually indicate immunity to HBV due to vaccination or resolved infection. Our second antigen is HBV core antigen, right? So this is a protein of the nucleocapsid, and again, our bodies are able to make anti-HBV core antigen antibodies, right? So they come in two flavors. The first one is IgM, right? So IgM, it actually indicates the recent infection. The second one is IgG. IgG indicates resolved or chronic infections, right? So our next antigen is HBV envelope antigen. This is a protein secreted by the virus that indicates viral replication and infectivity, right? So you can remember it by saying, if you look at this E, just mark existence, right? So it's highly infective and it's replication, right? So it's existing. Maybe you can remember it that way. But our bodies are also able to produce the antibodies against this envelope antigen called anti-HBe antibodies. And the presence of these antibodies indicates the long-term clearance of HBV infection. And also, HBV DNA is diagnostically important, right? So this is simply the DNA of the HBV, right? So now let's go into the HBV serology, right? So in the next slide, please, you need to take note because in most of the exams, this is what you're going to face, right? So get ready. Right. So what I'm going to do is I'm going to tell you the different stages of HBV infection. Right. So these include acute infection, window period, and resolved phase. If our body is unable to get rid of the virus, then it would persist into chronic infection, right? So on chronic infection, it can be divided into active chronic and inactive chronic infection, all right? So that's why here we have active chronic infection and inactive and chronic infection. The other thing which I want to tell you is because we actually have a vaccine for HBV, right? So I will tell you what you will see if the patient is vaccinated, right? So let's begin. During acute infection, yes, you will see the HBV surface antigen, right? But at this period, our body is not yet producing the antibodies against this antigen, right? So the antibodies will be absent, right? And the other antigen here we have is envelope antigen, right? Yes, it's there because it's still infection, is acute infection, but the same applies here. The antibodies are not yet there, right? But what about the anti-core antigen, right? The antibodies against the core antigen. Here, yes, you see the antibodies, particularly of the IgM flavor, right? And on HBV DNA, actually at first you might not see it, but later on you see the HBV DNA, and that's it. Then the next phase is the window period. So in the window period, you won't see the HBV surface antigen. You won't see the antibodies against it. The envelope antigen will not be there, right? But the antibodies against it, at first you might not see any, but later on you begin to see the antibodies against the envelope antigen, right? And the same applies to anti-HBC, right? So these are the antibodies like for against the core antigen, right? So at first you see the IgM, and sometimes you also see the IgG at the same time, right? And also the same applies to DNA. And during this window period, usually it's absent, but at some point is present. That's why I indicated both, right? Let's move on to resolved phase. So this resolved is like there was a prior infection, but your body resolved it or get rid of the virus, right? So in this case, you won't see the HBV surface antigen, but there will be immunity against the hepatitis B, right? So immunity is marked by the presence of the anti-HBs, right? So these antibodies are, and the antibodies against this antigen, right? So these antibodies, they indicate immunity, right? You are going to see it just a moment, all right? Let's move on, right? So we are saying it's resolved. So here you will not see the envelope antigen again, but you see the antibodies against it. And in terms of the core antigen, yes, you will see the antibodies against the core antigen, particularly of the IgM flavor. HBV DNA, you will not see any because we are saying it's resolved, all right? Moving on to chronic infection. Here we have active and inactive, right? So let's just start with active chronic infection. So if it is active, it means your body is unable to get rid of the virus. So you will see the surface antigens there, and the antibodies against it, you will not see them. Envelope antigen, yes, you will see it, and the antibodies against it, you won't see any, right? But the antibodies against the core antigen, you will see them, particularly of the IgG flavor, right? And we are saying this is like what? Active chronic infection, right? So here you will see the DNA. In inactive chronic infection, you will see the HBV surface antigen, but the antibodies against it you will not see. And for the envelope antigen, again, you will not see the envelope antigen, but the antibodies against the envelope, you will see them. And also the antibodies against the core antigen, you will see them, particularly of the IgG flavor. And the same applies to the DNA. You will see the DNA is still there, right? And here I have my values, but I think they are not important like at this moment, right? So let's conclude by talking about vaccination, because I said we have a vaccine against the hepatitis B virus, right? So what they do is like they give you this antigen, like the vaccine will have this antigen, right? So the only thing that you are going to produce is the antibody against this antigen, right? So these antibodies is the only thing you are going to produce, right? So if you test someone who has been vaccinated, you will not see this, right? Because I'm saying on vaccination, they will give you this and you will produce the antibodies against it. So you will not see it. You will get rid of this, right? So yes, it will be absent here. But the antibodies against it will be present, and the rest of everything here will be absent. So here I have a graph showing serology of a resolved prior infection by HBV, right? So firstly, the continuous lines are representing the antigens, and the dotted lines are representing the antibodies, all right? So firstly, after incubation period, you firstly see the HBV DNA, right? So this DNA and the HBV surface antigen are diagnostically important at this period, right? Later on, you will see the antibodies against the core antigen starting to rise, right? So here you have them. At this period, as you can see, the IgM antibodies will begin to decrease, but the IgG will be maintained high, right? Then the second thing I want to show you is, this lime green. This one is actually the envelope antigen, right? ABV envelope antigen, right? And after this period, after this window period, you can see that here there is no antigen. There is no antigen which is thereafter, and there is no HBV DNA, right? Okay, so here what you see is like after this window period, you see the IgG antibodies against the core antigen. You see the anti-HBV surface antigen and the anti-HBV envelope antigen. All right. All right. So the next graph is showing serology of chronic hepatitis B infection. Right. And as you can see here, you will see the antibodies which persist here are the antibodies against the core antigen. Right. But you will see that the antigen, like the surface antigen, is still there, and the envelope antigen is still there, right? And the other thing which is very important is the persistence of the HBV DNA. This is very important, right? Now, to conclude this video, let's talk about the hepatitis D virus infection, right? So this is actually a complication, and you will see why, right? So hepatitis D is actually a Delta virus. It's a single-stranded negative sense RNA virus, and it's secular, right? This virus is an incomplete RNA virus that can only replicate in the presence of HBV, right? That's why it's here, because without HBV or hepatitis B, you won't find it, right? How is it transmitted? This virus is transmitted through sexual way, parenteral way, or perinatal, and is actually endemic in Africa and in South America, right? What about the cause of infection? Actually, there are two things you need to know: co-infection and super-infection, right? Co-infection is mainly, we can see there is infection at the same time, and super-infection is like one after another. You have hepatitis B, and then on top of that, there will be hepatitis D, right? Right. So for co-infection, the complication is that there will be more severe acute hepatitis, right? Liver damage, right? And for superinfection, right? So we are talking about superinfection of a chronic HBV surface antigen carrier, right? So if the patient has this antigen, it means the patient is infected. And the complication is that there will be increased risk of liver cirrhosis,